still work to do. The 2 days were a good start. There's still questions. There are still things that occurred that did, in my opinion, and I think many of the members agree that did violate constitutional rights and freedoms. And to Representative Cruz's point, we should not subjugate, or rather subordinate, freedom for safety. And with that, Ms. Hines.
So first of all, I just want to thank, oh my gosh, I'm so emotional because it's been a long 5 years. But I just want to thank Representative Owen for his work on this, for bringing H.R. 133. And we are not done. And I want to thank Representative Wiley. Join us in our activism to protect an individual's right to say no to an unwanted medical intervention. And I want to give you a little bit of a background on how I got started in this. I grew up in Louisiana. We moved out of the state. We're out of the state for, thank you so very much. We were out of the state for about 11 years, and we moved back in 2018. And in that time, I come to find out that my children had been vaccine injured. All 3 of my children had been vaccine injured, and that turned me into an activist. When I moved back, I started, while I was living in Georgia, I served for a couple of years on the board of a fantastic organization called the Georgia Coalition for Vaccine Choice. I moved back to Louisiana in 2018, and I took about a year off because activism is exhausting, and I don't get paid for what I do. I was still raising my kids. I was a homeschool mom. I haven't earned a paycheck in about 24 years. But in 2019, I had taken a year off. In 2019, the Louisiana legislature, we'd moved back in 2018, 2019, the Louisiana legislature passed a law that tracked adult vaccinations. Up to that point, we were tracking minors to go to school. So I reached out to my state rep and I said, the state of Louisiana doesn't need to have any information on its citizens that they can use to incentivize, monetize, or weaponize against them. That was May of 2019. And literally less than a year later, we were hearing rumbles of immunization passports and vaccination passports. Our first letter, our first email actually even before that, we had a meeting with, at the time, Dr. B.U., Representative Edmiston came with us, and we shared with him our concerns, basically what Aaron Seary shared with you all in September, our concerns about vaccine safety, the fact that they had never been evaluated pre-licensure against a placebo, an inert placebo clinical trial, the fact that they were immune from liability, the fact that the schedule as it stood at the time, which was 72 doses of 14 different vaccines by age 18, had never been evaluated in its entirety as it is administered to children. We presented that information, I believe it was in January of 2020, to Dr. BU. But as we saw COVID hitting our shores, we started communicating with Governor Edwards' office. Our first email to them, I'm sorry.
Jill, can you identify yourself?
Oh, yeah. Oh,
yeah,
gosh,
we
I'm so sorry.
little formality here.
Sure. I'm Jill Hines. I'm co-director of Health Freedom Louisiana, or Consumer and Human Rights Advocacy Organization. But our first email to Dr. BU regarding COVID was in March of 2020. And we warned, because at the time, Louisiana Department of Health was recommending flu vaccinations to prevent from hospitals being overrun. They wanted people to not get the flu, so they were recommending flu vaccinations to help prevent hospitals being overrun for COVID. Well, we sent an email to LDH warning that flu vaccinations, there are studies that show that flu vaccinations increase your susceptibility to other upper respiratory infections, including coronaviruses. There was a study in 2015 by Cowan. There was a study in 2019 by the Department of Defense showing that flu vaccination increased your susceptibility to other upper respiratory infections. So we warned them. We started in March of 2020, warning that what they were doing had some consequences. We sent a letter almost the next day to President Trump, to Governor Edwards, and to LDH, because we already heard rumblings of COVID vaccinations being in production. So we sent a letter to all of these, even to the head of HHS, warning that all previous coronavirus vaccine trials led to something called pathogenic priming, wherein the recipient was more susceptible to coronaviruses. So we started from the very beginning. We sent them a letter in April of 2020 saying there's a law on the books that allows physicians under a declared emergency to try other things, outside the norm of protocol. We recommended high-dose vitamin C. We stressed the importance of vitamin D levels. This was in April of 2020. Throughout, we have pretty much all of our letters that we sent to the legislature, to LDH, to the governor. When the schools started adopting mitigation measures like masking and hand sanitizing, social distancing, we sent a letter to LDH and LDOE asking for the evidence that all of these mitigation measures were safe, especially for children. Tell us not only the physical safety of this, but we want to know the psychological safety. What's the impact of telling a child that they can't be within 6 feet of their peer, that their breath might hurt them? What's the psychological impact of that? We wanted to know. And the response that we only got one response from the executive council at LDOE, her name is Joan Hunt, and she told us that our questions was better asked of the CDC. And we responded, we said, well, the CDC has no fiduciary duty to the citizens of Louisiana. You do. You have to make sure. Also, we were very concerned. Act 9 passed in 2020. Act 9 removed all liability from the schools for implementing these measures that no one had determined were safe. So when she told us to, ask the CDC, you know what I did? I asked the CDC. I said, show us the studies saying masking children 7 or 8 hours a day, children and pregnant women. Show us that there's a safety study on that. They couldn't provide us a safety study. They sent us a link to the CDC website showing us how to wear a mask. There's no safety studies. We can talk efficacy all day long, but the concern is safety. The state has a fiduciary duty to make sure that the children under their care are safe, and nobody was concerned about. We started a program called the Smile Project, trying to make superintendents aware of the fact that they were violating their students' rights, bodily autonomy. We were talking about, mental health crisis. What has this done to students? We violated their bodily autonomy for 2 years. So when we hear people say, oh, we didn't know, especially when I hear public health officials say, oh, we didn't know, we told them. Every opportunity, we were here, we were testifying. I've probably testified in front of the legislature about 40 times over the last 5 years. They cannot say they didn't know. We told them. We were here in October of 2020. I promise I'll keep this short. I was here in October of 2020, October 6th, as a matter of fact, 2020. We brought 2 bills. There was the second extraordinary session of that year because of COVID. October 6th, and I remember it because that was the day we also got our biggest hit on social media. And if you don't know, I was suing the president over censorship. And that was the big day. And we were trying to get people here to testify on behalf of those 2 bills, and we couldn't communicate with them on social media. But we brought 2 pieces of legislation. Representative Danny McCormick brought a bill that would require schools to inform parents of their right to exempt from vaccinations. This was October, before a vaccine was even on the market, but we saw what was coming, and we knew that parents needed to know that they had an option to opt out. And a committee member on health and welfare told us that night their concern about passing that legislation was that if parents knew about it, they would use it. Members of the legislature have Your job, Article 1, Section 1 of the state's Constitution says the origin and purpose of our government is to protect the rights of the individual for the betterment of the whole. You don't get the betterment of the whole without protecting the rights of the individual. And not this committee, but the committee that was in this room that night told us that they don't want parents to know about their rights. The second piece of legislation that we asked for that evening was a prohibition on COVID vaccine mandates. And another committee member told us that it was a solution in search of a problem. And less than a year later, the federal government was mandating COVID vaccines. They were mandating EUA COVID vaccines. They were completely experimental when they started mandating them. And by the way, when we told LDH, because we communicated with them on this issue too, that EUA means experimental, they sent back a Reuters fact check article telling us that what we were telling them was wrong. I cannot begin to tell you the level of incompetence at LDH during COVID and how many people's constitutional rights were violated during those years. But I tell you all of this because, if I'm not mistaken, the number one recommendation in this report is to protect an individual from a mandate. And because we have activists among us, we have legislation next week that will do just that. And I'm here to beg you, as a committee, please send a recommendation for Rep. Amade's HB 555 to the Health and Welfare Committee. It's going to be in committee next week. We're very late in the session, as you know. We would love to get this passed. It's the number one, if I'm not mistaken, it's the number one recommendation from the report. And I hope that I have laid out kind of a groundwork or a background for you guys to understand. I know what I'm talking about. We saw this coming and we were fighting for everyone's rights while they were telling us that we were nuts, that we were anti-vaxxers. I don't know if I should wear that as a badge of honor or not, but we've been right the entire time, and we have the letters and the emails to back us up on this. So as an activist speaking to a fellow activist, I'm just begging you, please send a recommendation to pass HB 555 next week.
Thank you, Ms. Hines.
Thank you.
And I want to thank you for all your work, all of your activism. I know many members of this committee have worked with you in the past to help put forth some of this legislation, and I do share what you believe in.
Thank you.
Again, our freedoms should not take a back seat, even in times of emergency. That's how tyranny spreads. And so working within our lane and working within our capacity, we will continue to endeavor to do that. With that, I do have one more question. Just a little housekeeping. I do want to get Colonel Waller up here because he's got an interesting story himself, and he wants to talk about securing the grid. So, Representative Cruz, I know you were in the Air Force, but try to keep it brief.
It'll be on time, too. Jill, I just want to let you know you've more than earned a paycheck. It's just in our thanks and the thanks of the people of Louisiana. You and the Health Freedom Louisiana have been a tremendous resource through that whole experience, and I pray that we'll remember the lessons we've learned and we'll continue to follow the advice that you're giving us. I just wanted to mention that your involvement and all the people that show up for committee hearings are vitally important. When I first came here, my first session, there was hardly anybody in the room, and it communicates a sense of apathy, and I think that is a problem because committee members often believe it's apathy instead of people have jobs and people have duties. And sometimes we become a little negligent, I think, in our responsibility when we think, well, nobody cares. Well, they do care. They just can't always be here. So thank you for being here, and thank you for all the people that appeared over the last several years to make it known to us that we're acting on your interests, and we should have those at heart. So thank you.
All right, the board is clear. Vice Chair Oman, thank you very much. And I'm just going to wrap this segment of the agenda up with this. There are many members who serve in the military, myself included. And we all raised our right hand and we took an oath. And for the people who may be watching and looking at this, the oath doesn't go away. When you raise your hand and take the oath, it sticks with you. And that's part of the effort up here, is that we took an oath to defend the Constitution, and that's part of what this endeavor is about.